school year. I think I speak for the vast majority of teachers and students when I say we were very blessed and grateful to have in-person schooling. We were only able to maintain this, however, by adhering to stringent COVID protocols, including mandating masks for everyone in the building. For a few blissful months in May and June, we thought that the worst of the pandemic was behind us and we all relaxed a bit.
PCA believes a mandate will best keep students, teachers, and families healthy and will keep schools open. There are a number of reasons we support this stance. The CDC, the Utah Department of Health, and the American Academy of Pediatrics all recommend masks be worn by K-12 students regardless of vaccination status. And most of our pre-K through 7th grade students do not qualify for a vaccine yet. Positive cases have been increased in Summit County over the past 2 weeks, with the CDC labeling Summit County at high risk for infection.
Hi, County Council members. My name is Andrea Nee, and I am a Park City parent. I represent a large group of parents that are also here. As I'm sure you are aware, HB 1007 prohibits LEAs from mandating masks for students K through 12. This legislation puts the power of health decisions back with the parents, which is where it should stay. Utah law provides that parents retain the fundamental duty to exercise primary control over the care, supervision, upbringing, and education of their children. Parents will have the right to choose whether to send their child to school with a mask or without. The reality and data, even for Summit County, shows that children are very low risk for hospitalization and death from COVID. Adults are taking their fear of COVID and placing that burden on our children. The last thing our children need is decisions made for them based off of fear.
Good evening. My name is Terry Hill. I'm a parent with a 3rd grader and a pre-K student at McPullen. And I think that we all agree that our kids have a right to a safe in-person education. And where we may disagree is that your choice to send your kid to school without a mask does affect the other kids. I'm here to ask for a mask mandate so that our kids can stay in school all year in person.
I'm Jeff Henderson. I'm a ER doctor. My kids are going to be going to Jeremy Ranch this coming year. And a month ago, I was excited to send them with no masks, but I feel that things, I'm just going to say what, the CDC, what, the American Academy of Pediatrics is saying is that things have changed. We've got a super transmissible variant and we need masks. We know they worked. We all know they worked because we took a year off from being sick when our kids went to school with masks. That was my experience. I've never seen my children not have a cold, for 8 months.
Hi, I'm Cindy Matsumoto. I live in Park City, and I'm here as for the children of Park City, and especially for my grandchildren of Park City. And I think it's bad that you think that we're putting you through agony for public comment. I'm sorry for that, but I think it's important that you hear what the public thinks. And although you might not think you have the authority to help out in this situation, I ask you to reach deep and think a way around the state's rules. And I'm sure that you can find a way to support at least a 30-day mask mandate so that we can get our kids into school safely and until there is a vaccine. Thank you.
Thank you, Cindy.
Hi, my name is Chris Campbell. I have 2 kids at Jeremy Ranch. So there's a lot of emotions here and a lot of fear or concerns on both sides, but I think there's also opportunity to find more than 2 options, right? For instance, on one side, from a mandate standpoint, while nobody wants to be required to do anything, we have numbers higher now than last year, and we know that the mandates helped our kids stay in school. So I think that's a reasonable thing to consider on the table. If your hands are tied because you can't set the mandate for in school, if the health department says mandate for age K-12 throughout, regardless of whether they're in school or not, that gives you some opportunity. But ideally, we don't need a mandate. Ideally, we can come together as a community and to find a way to keep our kids safe, because it's not just my concern about my kid getting sick, but it's my concern that my kid's going to get your kid sick. And I know that if my kid wears a mask, that reduces the chance of your kid getting sick. So I'm willing to do that for other people in this room. And I would hope that we can work together to find a way to reduce the COVID transmissions back to where we were at the beginning of the summer when it was okay to go without masks.
And bottom line, asking people to wear a mask is a temporary inconvenience. I don't want to wear a mask. Wearing a mask sucks when you're trying to teach. It's exhausting. And I'm going to wear one anyway because I want to model for my students that it's not about me. It's about being respectful and about having empathy for everyone else. And bottom line, the temporary inconvenience of wearing a mask is nothing compared to the permanent inconvenience of dying from COVID or having long haulers or being intubated. And so I'd like to just err on the side of safety, of just in case, and let's just keep everybody safe. Why?
When researching the total number of deaths under the age of 18 for COVID in the United States, the most common number average was around 375 total kids. And many of those were immunocompromised or had a pre-existing condition. The politicization of this virus is inexcusable, and you can see and hear it in Summit County loud and clear. For the community who screams science, why are we not looking at the numbers right in front of our faces? Our children are going to be okay. Anyone who feels better wearing a mask should have that right. But those who don't should not have to wear one to go to school. Some of us want our children's immune systems to work like they are meant to do and fight the viruses that we will face now and in the future. Our school district did a commendable job last year trying to keep our kids in school and keep our kids safe. I am confident they will be able to do the same thing this upcoming school year without forcing mandates that are unnecessary and do not provide any benefit.
The evidence and recommendations overwhelmingly point to masks as the first and best line of defense for unvaccinated students. If a mask mandate is put into effect, we will likely again see a public health win, as we will have a successful school year, our kids will stay healthy, our teachers will be in the classroom, and our parents will be able to be at work. And our kids might even learn that sometimes making a small personal sacrifice for the greater good is what being part of a community is about.
I'm a parent at the South Summit School District. And I am here because I would like the choice for my children to wear a mask. I'm not against masks. I believe the data is firmly on the side of this position. The policy response to COVID, particularly as applied to children, has been inept. We now have nearly a year and a half worth of data. Not to use that data to craft better policies and create better outcomes for our children would be simply wicked. That data tells us several key things that argue strongly against masking children. Number one, children are at extremely low risk from death, hospitalization, or other adverse events due to COVID-19. They face 3 to 4 times higher mortality risk from the flu versus COVID, and a 10 times higher risk of suicide. Even with Delta, children are at extremely low risk, with some data suggesting that pediatric hospitalizations rate for Delta are less than half what they were for earlier variants. Multiple contact tracing studies have shown that the RO for children is actually below 1, meaning it is mathematically impossible for them to drive this epidemic. Mask mandates, especially in schools, do not reduce school or community transmissions. We've seen several studies in other states that have indicated that.
Good afternoon. My name is Megan McKenna. I am the steward for the Park City chapter of the American Federation of Teachers. We stand with PCEA in advocating for a K through 12 district-wide mask mandate. We understand that that may not be within your authority to do, but ask you to advocate as well for the health and safety of Summit County and our residents. We would also like to request that the Summit County attorney investigate the legality of the legislation that put the ban in place.
Folks are claiming mask mandates, restrictions on gathering indoors, and other safety protocols in our public school restrict their fundamental rights. They might, but you can't yell fire in a crowded movie theater. You can't advertise cigarettes within 1,000 feet of an elementary school. Students can't carry guns onto school grounds. Our fundamental rights are not absolute, especially in public schools. The Supreme Court, conservative and liberal alike, has already repeatedly established that public health concerns override constitutional rights in public schools. And when you choose to not wear a mask at school, or your child not to wear a mask at school, you're making a choice for me as well, and my children.
I'd like to say that I would really prefer that no one else is able to make decisions for my children and myself, but that my rights and those of others should not supersede anyone. I would also like to say that all of these statistics for and against mean nothing once you have a child who has this. So I would like to please ask you to enact a mask mandate if possible. Thank you so much.
We also want to ask, is it harmful wearing a mask for kids and teachers? It's not fun, as several other people said, but our kids wore masks all of last year and they were okay with it. The CDC guidelines, American Academy of Pediatrics recommendations explicitly state that unvaccinated people, that's all children under the age of 12 to date, should continue to be masked.
I'm a teacher in Park City High School, and I've been a teacher for 20 plus years. And we do what we got to do. If we've got to wear masks to protect the young and to protect whoever needs protection, that's what we did. And I'm here to ask you, if the county health department will suggest and recommend a mask mandate for K through 12 schools to support that mandate. In my religion, in Judaism, the #1 rule is called pikuach nefesh. Pikuach nefesh is the saving of one life. To save one life is to save the world entire. And to do something as uncomfortable as wearing a mask or dealing with the situation is well worth saving any lives.
I think most of the people in this room would agree that we should follow the data. Where I think most people in here disagree is which data to follow and what that data tells us. So what I'm asking is put a mask mandate in place for 30 days and compare what happens in our schools with what happens in the other schools here in Utah that don't have a mask mandate. Now you have relevant data with kids in our state with the Delta variant that's going on right now, that you can make a decision as to whether that mandate should stay in place or not. This way you're making an educated decision with good data that everybody can agree on.
I believe that we are in the middle of one of the greatest public health experiments that's ever been conducted in this country. Whether we are going to allow our kids to go back to school unmasked or whether we're going to support masks. So we can either be the control sample in that experiment and go unmasked, or we can do something to protect our kids.
I want to speak to some of the people who have been anti-mask, because fundamentally, I think that much of the framing there is fundamentally both hyper-individualistic and eugenicist. There is, no, seriously, right? Somebody mentioned that many of the children who had gotten COVID were immunocompromised. I ask, why does that matter? Why does it matter? Do children who are immunocompromised deserve to die? Do children who are otherwise at risk from COVID deserve to die just because they're immunocompromised? I don't think so. I think that people have inherent dignity as humans, and we need to protect the weakest among us.
I don't know why I didn't know about this meeting. There's a lot of people that have opposing views that didn't even know about this meeting. And another person that you should look up is Dr. Shiva Arudai, I think is his name. And he's done research on the mask. And he does talk about how it's dangerous to be breathing in your air all the time. There's several tests out there that have been going on, but that's not being reported. I think if we're going to talk about things, we need to talk about all sides, because it's been one-sided for the last year and a half. And you guys are going to turn into a communist country before you know it, because that's where you're heading. This is really where you guys are heading. Do you want to go there? Do you want to lose all your freedoms? Because that's what's going to happen. And I'm sorry, I'm from a country that doesn't have freedoms. I came here for these freedoms, and so did a lot of other people. But whatever reason, you guys just want to throw it out and censor everybody.
Thank you, everybody, for being here tonight. I'm Brian, excuse me, Brian Kretschmar. And I'm here as a teacher and as a parent. And I see a lot of people shaking their heads tonight and a lot of people smiling. And I wish my daughter could smile every day and know that she's going to wake up healthy, because she got COVID in September. And people can say that, well, it wasn't because of this and because of that, but there are people that made the choice to not wear the masks like they should have done and to not social distance and contract COVID and then give it to my daughter. My daughter now has POTS and wakes up every day wondering if she's going to be able to walk down the steps, not lay in bed all day long or for hours at a time, have to worry about whether she's going to crash her car when she's driving around because she's going to pass out. So I just want people to think about the kids, and I'm here as a teacher too for your kids, for the parents that are here that have kids in our schools. But this does really affect people. And it's not about fear, and it is about the data, and kids are being affected, and little kids and all kids. There are kids that this does affect, and it's not a joke. It's not a hoax. It's not a scam. It's not some right, left. It's a sickness, and it's a disease, and we can do something about it. And thank you for having this conversation. And please, let's have the 30-day mask suggestion that people made, and that would be great to help protect all of our kids. Thank you.
Thank you, Brian. I did want to throw out a couple, if we're all talking about science here and the health of our kids and that sort of thing. There was a few studies that I had sent you all that might bear repeating. One was published in the Journal of the American Medical Association of Pediatrics. The generally accepted limit for CO2 levels is 2,000 parts per million, with anything above that being deemed unacceptable. This study found the mean CO2 intake in a child wearing a face mask to be over 13,000 ppm. The youngest children in the study had the highest levels, with one 7-year-old reaching 25,000 ppm. These levels were achieved within 3 minutes of wearing masks. And as we know, the children are made to wear these masks for hours on end. There was another study in which a concerned group of parents had their children's masks analyzed after 1 day of use. I think it was actually only after a few hours of use. The University of Florida analyzed those masks. Of these 6 masks analyzed, 3 contained pathogenic strains of bacteria. 2 contained antibiotic-resistant strains of bacteria. A total of 96 unique strains, 21 of them pathogenic, were found on the masks collectively. Note that although these tests were also capable of detecting viruses, only 1 was found. Just keep going until my time's up here. There was also just in masks in general, a study published in the Annals of Internal Medicine on over 6,000 people in Denmark, half wearing masks, half not, finding masks to be 0.3% effective, more effective than no masks in preventing a transmission. There was also a study in the Stanford study published in the National Center for Biotech Information, entitled Face Masks in COVID-19 Era, a health hypothesis, sorry. And a couple quotes from that: the data suggests that both medical and non-medical face masks are ineffective to block human-to-human transmission of viral infectious disease, such as SARS-CoV-2 and COVID-19. According to the current knowledge, the virus SARS-CoV-2 has a diameter of 60 nanometers to 140 nanometers, while medical and non-medical face masks thread diameter ranges from Thank you, Ryan.
55 to 440, more than 1,000 times larger. And when we're all skiing over the summer and we saw our breath coming out, that was water droplets, just to throw it out there. But thanks, everybody.
Hi, Council. I'm Brandy Connolly. I'm a mother of 3. 2 are at Parley's Park. 1 will be in preschool because I work. I am vaccinated, therefore not wearing a mask. My children are not. My aunt spent her career in hospital administration. She's in Arkansas. She called me 2 days ago and said, Brandy, there are 12 kids in the ICU, 8 on vents. She said, most of them did not have any pre-existing condition. Are you going to send your kids to school this year? I couldn't answer. Over the past year, this county has led the way in the pandemic. We were the first one to see cases. You as county council, Rich, Dave, you fought the government, you put in mask mandates. You held them longer than anyone else in this state would do. It's time to step up and do it again. Yes, maybe it is the state school board's right to ban it for everybody, but come on, you can do something. That's why you're here. That's why this county is so great. We as parents asked our kids last year to wear masks when the disease was not transmitting among children to protect us, not them. So this year, when it's time to protect them, are we as adults really going to say, you know what, never mind, if you die, it's okay. Our lives were important, yours weren't, because that's really what we are doing. So take a stand. This is a marathon. We're at mile 21. We've hit the wall. We all want to take off our masks. We want to walk away. Make it the last few miles for the kids until they can get vaccinated. Keep them safe. Salt Lake City has taken a stand. Their county council's reviewing it. In Texas, judges have upheld the ability of a county to do something different. Dave, please use those legal precedents and figure out how to keep our kids safe.
My name is Maggie Newcomb. I have a 4-year-old and a 6-year-old who are enrolled in the district schools. They can't be vaccinated. We're just asking you to buy us some time.
But I see friends in here masked and friends in here not masked. I think that you can have someone come up here and say, follow the science, respect the experts. And then you have someone else come up and say, reject the experts. Why are we following their rules? Let's override them. This is becoming an endless war. I say stick to freedoms and individual choice. Wear your masks, do it. I mean, it goes and goes and goes. So that's it.
Thank you, Joey. All right, I'm not seeing much more activity from the group. Is there anyone out there who would like to speak on anything that we haven't heard on tonight? Okay, in that case, I will close the public input for this evening. And yes, we have a request from Chris Robinson to speak.
I just want to say how impressed I am with you all as parents caring about your kids. I suspect maybe this is the kind of thing we'd see if we were the school board more, but it's impressive that you come out and share your opinions with us. So thank you. And we have listened and will continue to process.
And thank you for your civility. I think that it's really notable to see this crowd of people that are divided on an issue that are able to be respectful to each other. And I think that is really commendable of the residents of Summit County. And thank you for leading that and showing that example to maybe some other areas where that's not the case.
No pushing and shoving going on. Okay. And I guess I'll make a concluding comment for the night. The council has discussed this issue. We have not come to a firm decision as of this point, other than that we know we have to work with the state school board, and we're working on a strategy in that direction. And that's about the only outcome I can give you from our discussions so far. And listening to you all tonight was very instructive, and we thank you for your participation.
And I'd like to emphasize, hold on one second, I would like to emphasize, those are two important contacts. The school board, the State Board of Education controls everything pursuant to the Utah Constitution having to do with schools. They have the right to decide. So please make your voices known to them. Write them, contact them, send them the same kind of correspondence you sent to us. That helps us, that gives us some leverage when we communicate with them as well. So all of you, whichever side you're on.
First one is from the Park City School District, the second one from North and South Summit School Districts.